You got it.
Thank you. Germany, the president of the Cannabis as a Medicine Working Group and the International Association of Cannabinoid Medicine, Dr. Franjo Grotenhermen.
Hello to everybody. It has been a long day, I think. So I shall keep it short. I want to talk on interactions of cannabinoids with other drugs. I am working in a medical practice, and I have to talk with this issue with my patients. And of course, I've read the scientific news on this issue, and also wrote articles on this aspect. Please, the first slides. First, my conflict of interests. I'm working for two companies, Endoxo and MyCB1. Now comes the first slide, review on interactions. Do you see the slide? I hope you see it. Okay, we have basically two kinds of interactions. There may be so-called pharmacokinetic interactions, which is mainly based on degradation issues. For example, if one enzyme in the liver is responsible for the degradation of THC and another medicinal drug, there may be an interaction. We will talk on it in detail in the next few minutes. And then we have another kind of interaction. These are so-called pharmacodynamic interactions, which are usually based on the effects of THC on the one hand and other medications on the other hand. For example, if you give THC together with a sedating drug, then sedation by THC and the other drug may increase each other. So these are the basic kinds of interactions. Now we come to the next slide, which is about pharmacodynamic interactions of THC. Well, we know the pharmacokinetic, the effects of THC, for example, on psyche and cognition. And you can imagine that if other medications have effects on psyche and cognitions, there may be interactions. For example, sleeping pills, alcohol, etc. So if you take cannabis together with alcohol, you may have an increased psychomotor impairment. Another great area of interactions are those on heart and circulation. For example, THC is usually lowering heart pressure. If you take already medication that reduces heart pressure because you have high blood pressure, then there may be an additional effect. I have many patients who get cannabis, for example, against pain, and they also have high blood pressure, and they tell me I can reduce my blood pressure medication. On the other side, if you give, for example, beta blockers together with cannabis, beta blockers may reduce the increase of heart rate induced by THC. This may also be relevant if you accidentally give a too high cannabis dose and patients have fear because of the high dose and get tachycardia. You can offer them beta blockers to normalize heart rate. If you give it together with amphetamines, THC, then heart rate may increase because amphetamines might increase heart rate and amphetamines. So there may be wanted interactions on circulation and unwanted interactions. Just think about what THC and CBD, what effect they have, and what the other medications do. What do they do on psyche, cognition, circulation? This is rather logical. Some effects on the digestive tract, for example, interactions with medications that cause dry mouth, for example, tricyclic antidepressants. And there may be also some effects on bowel movements because THC may reduce bowel movements a little, only a little, not in the amount of opioids, but a little. Many interactions may be of therapeutic value. For example, you may find synergistic actions of opioids and THC in pain therapy, or you might find interactions between THC and medications used for reduction of intraocular pressure. There may be additive or synergistic effects. So this may be used therapeutically. You may reduce the amount of opioids so that side effects are reduced if you give cannabis in addition. I think this is rather easy to understand. Well, the next slide. So this is a little bit more complicated. It comes to pharmacokinetic interactions. THC and CBD are mainly metabolized in the liver by chrome P450 isoenzymes. And then they are degraded, for example, THC to 11-hydroxy-THC or THC-COOH, yeah? There may be interactions with medications which use the same enzymes. THC is mainly metabolized by the isoenzymes CYP2C9 and CYP3A4. CYP3A4 is an isoenzyme which is used by many medicinal drugs. CBD is also metabolized by CYP3A4, but also by two other isoenzymes. If a medicinal drug is given together with THC and CBD, this may influence the blood concentrations of the medicinal drug and THC and CBD. Concentrations may either be increased or decreased. Now, please, the next slide, we will have a closer look at this issue. Some medications reduce the activity of CYP enzymes. For example, ketoconazole. In this case, the concentrations of THC and CBD may increase. The degradation does not work so fast as usual because the other medication is reducing this activity of the enzymes. This may cause a longer duration of THC effects and CBD effects. This may cause an increase of blood concentration of THC and CBD. Perhaps you have to reduce the amount of THC and CBD which you usually give. You have to adjust the dose of THC and CBD. But I do not want to make it too complicated because these pharmacokinetic interactions usually do not play a major role. I tell you later where it may play a role. You usually use amounts of THC, 10 milligrams, 20 milligrams, 50 milligrams, which is usually not relevant with regard to pharmacokinetic interactions. But sometimes CBD is given in very large amounts. For example, if you treat children with epilepsy with 10 or 20 milligrams per kilogram body weight CBD, and they get additional 1 or 3 or 2 other antiepileptics, there may be an anti-action because you give 300, 400, 500 milligrams. Then this may be irrelevant. We come to this later. You have to have in mind that throughout the last decades, THC or cannabis products or CBD products have been given to millions of people who take a large amount of different medications. And the usual interactions you see are of pharmacodynamic matter, kind. Sedation, circulation, psyche, and not pharmacokinetic. So we come to the next point. THC and CBD may increase the concentration of other medications, since they both need the same CYP enzymes, for example, clobazam. That's what I told you previously. Clobazam is an antiepileptic. It's often used in children. So if you give high amounts of CBD and high amounts of clobazam, the concentration of clobazam may increase because there's a concurrence because of the same usage of the same enzymes for degradation. And you may have to adjust clobazam dose. Next point. Some medications increase the activity of CYP enzymes. For example, rifampicin. In this case, concentration of THC and CBD may be reduced. This is not so relevant because you won't see increased side effects. You simply see well, THC does not work as well as previous, and you may have to increase the dose a little. But usually in the doses applied, this does not make any relevant effect. The last issue is THC and CBD may reduce the concentrations of some medicinal drugs, including clozapine or olanzapine. There are other interactions with other drugs. For example, cytostatics used in cancer therapy. But usually the concentrations of these drugs are increased. So you have no weakening of the effects of these drugs on cancer, which is maybe a major problem. If you take a cancer drug and the effect would be decreased, this would be, of course, of rather high importance. But if the effect is only increased a little, this does not really matter. Many patients use cannabis to treat side effects, nausea, appetite loss, and this is usually not a problem. Let's continue with the example of cancer. If I have cancer patients and they ask me, can I take cannabis in addition? I usually say yes. There may be two exemptions. One exemption is if a patient is treated with tamoxifen, a breast cancer patient treated with tamoxifen, because tamoxifen is also binding to cannabinoid receptors. So there is an interaction at the receptor level. This may also happen. And the other issue is that THC and CBD may be reducing immune function a little bit. So a combination with an immunotherapy, it is unclear if there may be an interaction, if this effect may be weakened. Thus, the bottom line is you should be aware of the effects of THC and CBD, the pharmacological effects, pain reduction, sedation, reduction of the effects of the immune system, and if you combine it with other drugs, should be aware that there may be an influence on the pharmacological effects of the other medicinal drugs. And there may be pharmacokinetic interactions, usually due to degradation in the liver, but also on the receptor level, in some types, in some cases. But the pharmacokinetic interactions usually do not play a role, with the exemption of perhaps epilepsy in children, because we use high dosage of CBD. If we later see that CBD is also used in, for example, schizophrenia, psychosis, high doses are used, 800, 1000 milligrams per day, and we give it together with neuroleptics, there may be some interaction. But so far we have not seen any side effects, any relevant interactions. So this was it. If there are any questions, please let me know. This is a fascinating field, which you should have in mind, but don't be worried too much. Yes? Okay. Many thanks.
Can you see us in this camera? Rear? No. Well, anyway.
Oh, there we are. Yeah.
Yeah.
You're the shorter one.
Thank you, Michael. You always have something to say, don't you?
Oh, yeah.
Okay, so far we don't have any question in the app. So does anyone who wants to place a question to Dr. Franjo?
We're good?
No questions? Yes, one question.
Here, thank you.
Obrigado por esta partilha fantástica de conhecimento.
Just a second. How is it going to happen, the translation? I need to do it, so we have to do...
So we have
Okay.
to talk slowly, so
We have to make the questions really slow because of the delay. So I will ask to do it briefly and I will translate sentence by sentence. Vou-lhe pedir para ser sucinto porque há um delay na pergunta, então eu tenho que traduzir frase a frase pausadamente, o mais curto que conseguir. Pode ser? Ok.
Obrigado por esta partilha de informação.
Thank you for this sharing of information.
Vou ser muito objetivo. A esquizofrenia é uma doença que tem estados psicóticos muito graves.
Okay. Schizophrenia is a disease that has psychotic stage really serious.
Qual é o impacto real que os canabinoides podem ter na doença, quer sejam administrados sozinhos ou em conjunto com outros fármacos?
What's the real impact that cannabinoids can have on the disease?
Sorry, I did not understand the question. Could you please repeat it?
Oh, I forgot. What's the impact of the cannabinoids in the disease, in the schizophrenia, in the psychosis? The impact of,
of
Say it.
psychosis and
Yeah.
schizophrenia. What are the positive implications of cannabinoids with?
The effects of cannabinoids on psychosis?
Yes, psychosis and
Schizophrenia.
schizophrenia.
Yeah. We have a few studies which show that 800 or 1,000 milligrams of CBD, cannabidiol, may be as effective as neuroleptics in the treatment of schizophrenia. And we have another study that the addition of CBD to standard medication, to standard neuroleptics, may improve the outcome of patients with schizophrenia. And in addition, we have some data from animal studies in animal models of schizophrenia that CBD may prevent the development of schizophrenia or psychosis or schizophrenia-like behavior, so that it may be preventive. With regard to THC, this is absolutely different. We have some evidence that THC may increase the risk for psychosis in people vulnerable to the disease. So if in your family there's schizophrenia, the initiation of schizophrenia may be increased. We have two case series from the USA, from a hospital of psychiatry in New York, that in certain schizophrenia patients, THC may be beneficial. And the authors suppose that in these cases, the schizophrenia has another cause than usually. Usually, schizophrenia is treated effectively with neuroleptics. And in these cases, neuroleptics were not affected, but THC. But this is an exception. The problem is that for the treatment of schizophrenia with CBD, you need very, very high doses, and patients usually cannot afford treatment with 800 milligrams of CBD a day.
Thank you, Professor. You got it.
Thank you.